أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الرحمن علم القرآن خلق الإنسان علمه البيان. Respected listeners, like always, आज की बात शुरू करने से पहले remember appreciation. Appreciate anything that you have, that you do for others or others do for you. So learn to live with a attitude of gratitude. Today the topic of the short case is a locomotor system. Like in any system, the command can be examine the joints or locomotor system. So you start with the introduction, consent, exposure. Ideally it should be in single shots, but do keep in mind about the weather and the modesty. Then start with the hand sanitization. General look whether the child is sick or well looking, cyanosed or respiratory distress at rest, pallor or jaundice, nutrition status, diagnostic or dysmorphic features. Then ask for the pain in any joint and examine the affected joint at last. This is very important. Expose all the joints and inspect for swelling, redness, deformity. Then palpate for increased temperature and compare with the normal skin on both sides simultaneously. Appreciate the tenderness and fluctuation. Then in the hands, check the finger flexion, make a fist, wrist flexion, wrist extension, finger extension, ulnar and radial deviation of hands, opposition of thumb like rosary or tasbih. So this is the reflection, this is the extension and hyperextension. This is the flexion at the elbow joint and extension, wrist joint and extension at the wrist joint. This is the radial deviation at the wrist joint and ulnar deviation. And this is the opposition at thumb. After that, go to the elbow and check the movements at elbow joint, that is the pronation and supination, turnkey sign, flexion and extension. Then at the shoulder joint, ask the patient to embrace, scratch on the back and circumdentation movement. So these movements are basically to check the movements at the shoulder joints. So this is the picture of the supination and pronation. Then at neck, tell the patient to put the chin on the chest and then head back, salam on both sides like in pairs, touch head like they touch ears on the both shoulders sideways. Then spine, always check the spine in standing position. Then tell the patient to touch toes of foot with fingers of hands while bending. So this will tell you about the sacroiliac tenderness. Sway from side on side with the arms on hips, turn sideways while arms on hips. Then on the foot you check the dorsiflexion and plantarflexion, inversion and eversion. At the knee joint there is a flexion and extension movement. At the hip joint, while lying in the lateral position, touch knee with abdomen, flexion, in the same position, straight leg, backwards extension. Remember the leg should be straight. Then relevant examination on the hands, you can look for the clubbing, koilonychia, leukonychia, pulse, epitrochlear lymph nodes, PCG scar. On the head, check for the alopecia. Eyes, you check for the redness, which can be in the juvenile idiopathic arthritis, pallor, malignancy. In the mouth, check for oral ulcers, which can be a sign of SLE. In CVS, auscultate for mitral regurgitation in traumatic carditis, pericarditis or pericardial lub, which is a sign of SLE. In abdomen, check for the liver, spleen, which can be the sign of JIA, pancreatitis in SLE. Then lymph nodes and skin for the petechiae and bruises. So the differential diagnosis, if there is a monoarthritis, you can consider septic arthritis, tuberculous arthritis, trauma, hemarthrosis, hemophilia such as target joint. If there is a polyarthritis, you have to see whether it is deforming. If it is deforming, then it is a JIA, should be in the differentials. If it is non-deforming, then consider SLE, reactive arthritis, rheumatic fever in differentials. So now on the septic arthritis, few words. It's present in less than 5 years, is more common. The organisms which can cause septic arthritis are Staph aureus, H. influenza type B, Haemophilus influenza type B, Group A Streptococcus, Kingella kingai. In neonates, gram-negative are more common and Group A beta hemolyticus. While in sickle cell disease, Salmonella is the major cause of septic arthritis. In penetrating wounds, coagulase negative Staphylococcus, while in nosocomial Pseudomonas is the cause of septic arthritis. In HIV, Bordetella hansenii, while in immunocompromised fungus such as Aspergillus and Candida can cause septic arthritis. So what are the investigations of the septic arthritis? X-ray will tell you about the soft tissue swelling, the joint space will be narrow, the changes occur after 7 to 14 days. On ultrasound, it will tell us about the pus, fluid and effusion. MRI is as sensitive as bone scan. Joint fluid or pus and excludes osteomyelitis. You do the joint fluid aspirate for culture insensitivity. Bone scan excludes osteomyelitis. Cultures of the blood and synovial fluid. Then the treatment of septic arthritis, medical in neonates, you just gave nefcillin in a dose of 150 to 200 mg per kg per day plus cefotaxime 100 mg per kg per day BD for 1 to 2 weeks. In older children, cefazolin is given along with nefcillin, while in case of MRSA, vancomycin plus clindamycin can be given. The surgical consultation is required, and hip joint infection is a surgical emergency due to femoral head blood supply compromise risk. Other joints require joint fluid aspiration for 1 to 2 days. If fluids continue to accumulate after 3 to 5 days, arthrotomy is done. Normal saline is instilled in the joint. The duration of antibiotics for Streptococcus it is 1 to 2 weeks. For Staphylococcus it is 4 to 6 weeks. For unknown it is 4 to 6 weeks given. Shift to the oral drugs after 2 to 3 weeks of IV treatment. The complications of septic arthritis are osteomyelitis, venous thrombosis and septicemia. So the prognosis of septic arthritis is good if the treatment is started within a week of start of the disease. There is a 10% chances of relapse. If with pus discharge and antibiotics no improvement is seen in 72 hours, you consider changing antibiotic, consider surgery or review your diagnosis. Long-term follow-up is required. So thank you very much. This is basically just a guidance for you so you can make your own schemes. The main purpose is you have to act like an investigator to find the signs of any disease that you consider. So I end with the prayers that may Allah be our protector, helper and guide. Allah Hafiz.